First of all, I'd like to present Bhanu and Ranjan, who is at the Jain School of Global Management in Singapore. She is somebody who will be presenting on transforming mental health care while harnessing artificial intelligence. And this was, again, it was part of the open call, something that we thought really bridged a lot of the areas of focus that we know are coming up over much of the rest of the year. As I've said to you, we're undergoing a great big sort of open and consultative process as to exactly the areas that we should be focusing on, and artificial intelligence, of course, is one of them. So we're very pleased to be able to welcome Bhanu Ranjan today, Dr. Ranjan, to the stage to present. So without further ado, please join me in welcoming her.
Hello, everyone. Very good afternoon. I know it's not a good time to present after lunch. I'm aware of that. And I'm also aware of what wonderful presentations you had yesterday and today. So I'm going to be super creative, and I'm not going to bombard you with information I wanted to share. Few slides are slightly high on traffic. They are cluttered. Please make sure you spend some time on it later. They do have value, but for today, to resonate the idea of AI and some fun stuff which I have for you is something very important. Okay, I've kept my stopwatch also ready, so I'm all in control. Okay. So I come here as a mother, as a wife, as a daughter, as a human. And to all of you, this particular presentation, this particular topic is actually done by my student, an executive MBA student. And I would like all of you to give a big round of applause to Rashmi Malpani. So actually, yeah, that's the name there. So I was a supervisor and I guided her throughout the whole project. And she's going to be graduating soon in June. And right now she's in Canada watching us live. So Rashmi, very well done. Okay, so this particular topic is extremely close to everyone's heart, mine and yours as well, because it's about us. Yeah, every one of us has been part of our mental health. And it's extremely important to address it. And how am I going to address it with, of course, the new buzzword is sustainability, AI, everything. I mean, I really enjoyed yesterday's presentations where Mr. Killer was talking about how the publications have, gone leaps and bounds on this particular topic. Yes, that's true. But again, every researcher has his own unique way of addressing the topic. So I'll be sharing with you my qualitative analysis, one wonderful case study, and one live experiment, which is happening right now in my house, and I'm doing it for my daughter. It has been running so well, we might convert it into a paper. So I would like to share that also with you. So these are the three important takeaways for all of you. One is a qualitative analysis of AI in mental health. We did purely on group discussion, basis. And the second is the case study, which is from Singapore. And I come from Singapore. And Singapore being a smart nation, and of course, they are having issues, whatever you discussed since morning, aging and many other issues which are also happening there. Mental health is also something which Singapore takes it very, very seriously. So we will have some ideas, and I think those ideas will really, really help you all. Okay, so before I begin, I would like to congratulate Kevin Kester yesterday, Keith Miller, and also during the poster competition, the display. Is Somaya here? Okay, so I promised her yesterday that I'm going to talk about her poster today. And also one young boy from NTU, Huang, is he here today? Okay, all the young ones are enjoying outside. Okay, never mind. So I would like to mention, why am I mentioning all the two presenters yesterday and these two, especially from the poster? Kevin, because he talked about the war and conflict. It has a direct impact on our mental health. So I did see these micro expressions in our ecosystem, not directly, indirectly, but yes, it is impacting us some way or the other. Okay, but how are we dealing with it is because we have our own coping mechanism. So finally, I value your time, which you are giving me today after lunch. And I promise you, once I end my presentation, I will just ask loudly to all of you, did I bring value to your time? And if I get a great roar or echo from the audience, I mean, I did present some value. So we'll see how it goes. It's totally up to you all. Okay. And the other thing which I really enjoyed yesterday was about Mr. Keith Miller's presentation. And he talked about aging and he talked about some amazing robotic stuff, which is true. So I would be converting that, the whole thing, because I have two elderlies at home right now, 88 and 82. One is my mother-in-law and one is my own mother. And they both pretend that they like each other, but they don't. And for my own mental health, so that I can go back and work and be an efficient professor, an effective teacher, especially when handling lectures after lunches, I have to be very, very careful and take care of my own mental health as well. So again, a very human, very actionable database for all of you. And I'm going to share it in a storytelling form so that you guys can apply and see if it really makes sense later on. Okay, so coming back to the poster. So Somaya had a poster where she talked about Middle Eastern fathers. You know how Saudi Arabia, and she talked about those fathers reading stories to their kids. Now that took my attention. I was like, oh, I've never heard of, because I just came from Dubai and I taught there for 15 days and I met so many friends. I didn't come across anyone who was reading stories to their own children, especially. Okay, so that was a great gap which she identified. And when I talked to her yesterday, she said, and say, how are those kids doing whose fathers are participating? Because she said, I observed, and when these kids go back to school, they are super confident because not many fathers in that particular country are doing this. So are you getting the whole ecosystem of mental health, those micro expressions and everything impacting us? So that was one thing I wanted to share. Another poster which I saw yesterday was from NTU, and it was about prolonged grief. So I really like that, because sometimes when we don't give closures to the people who've departed from our life, it again impacts our mental health. So I took these, again, snippets from yesterday's presentation, and I thought I'll just combine it together, because this particular topic doesn't start here, it doesn't end here. As I said, we all part of this journey. But during my presentation, I do have a different perspective. Please, I do not have any intention of hurting any one of you, but please welcome and respect me for a different point of view I bring in today's hall. Okay. All right. So this is something which was really, really interesting. And here it goes. Okay. So that's the main author once again. And I am the co-author, and I've done a few things because I was presenting. So Rashmi will forgive me for that. The research aim is extremely clear. There are only two things in my presentation: AI and mental health, whosoever needs it. And how are we taking care of these two parties? And the intervention between them has to be cost-effective and smoother. So how can we do that? So this is the whole idea of, so my right-hand side is the AI and my left is the mental health. And how are we intervening? So when I talk about AI, they could be the counselors, they could be the psychiatrists, they could be the parents, they could be friends. I don't know. We are taking the aid of AI and how it is helping us. So, and of course, we are talking about cost efficiency and accessibility. So I'm very, very happy that my research has proven that it is cost effective. Okay, and but what are the ways and how we can do that? I leave it to you all to do your own research, and you'll find so many. And we took a qualitative group discussion on the basis of what we found on the EBSCO, ProQuest, Google Scholar, and AI engines, ChatGPT, and many other. That how are we applying that? And if we're applying that, and these were practitioners, by the way, in the group discussion, where they shared with us that it does work. Okay, so the goal is to formulate a strategic framework, which is an on-the-go job. So there are many youngsters who are research scholars in this room right now. For them, please identify where you can take off this particular research on a different level. So you will find some opportunity of converting the next step of because there are limitations in my presentation. And I want all of you to note those limitations, and I will mention what the limitations are. And you can convert that into something different, because as I said, it's ongoing and it will become even more complicated and, different as the time passes by. Methodology is purely qualitative. The approach and the outcome, there are actionable guidance, and finally is an understanding. Okay. So going back to today's topic, I really liked when the speakers talked about the aging. Remember the sign? So it was so wonderful when my mother was about to come to Singapore, and she takes more time to cross the road as compared to my mother-in-law. So now both of them were just thinking that should they go for a walk together, because if one is taking around 15 seconds to cross the road, the other takes around 30 seconds. So I just wanted to add on to the presentation in the morning. We do have signs in Singapore, but we also have a special sign of slightly more time needed for that. So that there are 2-3 buttons on certain junctions of traffic. So if a super elderly person, like for example, if I'm crossing, I might take 10 to 15 seconds to cross. But if I press that special button, which is meant for those who need some extra time, the road allows you to take that crossing. Isn't that wonderful? So this just takes you to a different level altogether. And yes, I really like the concept from my own Singaporean friend who said that we do not have an aged day out there. Yeah, we will soon try, and if we can have that as well. So I hope the pieces are making sense so far. It's going very well. Yeah. Okay. Now I would like to feel the vibe here, and let's see. It will depend how you all are going to. So just enjoy. Okay. Self-read slide. Okay. Expressions. Great. Okay. Thank you. Thank you so much. So again, it's all about understanding, because we do grow and during our journey of life, and we do go through our own mental journey. Yeah, my tomorrow's topic where I'm talking about over there, I'm super stressed about myself, because whether I will be there in the job for the next 5 years or 10 years, so that's something which is worrying me. But this part of the topic today is definitely giving me some great results, and I'm very, very optimistic about it. Okay, so this is one thing. And the other thing which I would like to share, and how AI has the potential. First of all, early detection and diagnosis is very, very helpful in mental health. Number 2, personalized treatment. Now, I would share a case study here for personalized treatment. Now, I have a friend, and they're super flourished and very wealthy and very educated. They both, wife and husband, work in computer science. They're like geeks of the industry. And they have a child, the only child, and he has many mental health issues. So what they have done, and Singapore being a smart nation, smart city, or whatever you call it, there are a concept called smart home coming up in that country. And they have invested in their house all the devices, which goes with the mood for their son, which goes with the sleeping patterns, with the way he can interact. And believe me, when you step into the house, you are in a different world altogether. So they have invested, because they said, what else can we do for our child? At least this much we can do. And we see him very confidently in the house, roaming around and having an interaction as a regular human being they wanted to see in their child. So this is another, of course, I can't take names here, but it is a real, and if they give me permission, of course, I will share with you all later. This is something really fascinating. So there are smart homes being catered, depending on how much people can invest and help their loved and near and dear ones. But here we are talking about the cost efficiency part as well. So that is the next thing I would be talking about. Okay, so accessibility is another thing. Stress and reduction is another wonderful thing which we can talk about. Predictive analysis was another very helpful technique which AI has a potential, because the whole database gets collected in one place. And if one person in the corner of any village or any part of the earth has an issue and nobody's able to understand, they can go back to the reservoir of body of knowledge and they can extract the information from there. But the only concern for AI, which I'm being very upfront about it, it's the privacy and the data protection. That is one thing which I have not been able to, and I need countries to come together or the policymakers to come together, because we do not have that power. Ethical consideration, depersonalization of care, accuracy, reliability, these are few things which I think the scholars out here in this room can take this further. Okay, all right. So this is not a very happy slide. It's showing how much the mental health is needed across the world, and it has gone up. Okay. Can you imagine a time when you all were growing up, at least when I was growing up, and if there was any issue, there was no social media, there was no internet. I belong to that time, by the way. And so if I had anything like that, say, Mom, I'm not feeling well today. Come here. What did you do? Something like that, and I would be fixed. So that is the time where we have grown up, and it worked. But later on, social media came in and we just somehow embraced it so well. We all know, but we didn't realize are our kids or us also ready for that coping mechanism? So that is something which was not present. And that's how we see so many numbers going up, because sometimes we see the children or us are being judged by someone we don't even know. And when I read the feedback in my real life as well, there are about 100 comments, right? And there would be one comment would be really nasty. Believe me, it gives me 2 sleepless nights. 99 comments were great. But there was one line which was extremely nasty, and I don't even know who gave me that. It bothers you. So please do not forget that this pump in your chest, which is, which is important, and it does trigger, it does matter to us. And so that is how we have to take care of ourselves going forward. So the research objectives were wonderful. We had 2 objectives. One was to investigate and one was to create. And our research questions are, again, they were 4. And we could not do justice with all 4, but we definitely tried. And as I said, the PhD scholars can please take this further, whatever my limitations are, which can be taken further. The keywords which we played around are on my right side. And the medium which I had used for my body of knowledge was on the medium side, on my left side. Okay. This was a research framework which was purely qualitative. So I'll share with you the whole journey. The first one was the questionnaire development. Then we started creating group discussions. Not every group discussion was constructive. We had themes. We took the notes. Then we had codes connected to those notes. And finally, with those codes, we had themes coming out, and theme mapping was done. Then the report was generated. And finally, we have the 3 conclusions, which I will share with you all soon as well. Yeah. So the case study which I was talking about, the lovely parents who did the whole smart home thing, I'll tell you what all they did. They caught hold of a psychologist and a psychiatrist, and they tried to analyze their son's behavior through emojis. The choice of emojis. So that was interesting for me. And since I told you, they were both in this area of AI, they were the one who would be contributing also somewhere. I don't know much about it, but they are definitely, but that's how they are helping it. Okay, number 1. Number 2 was music mood analysis. And they created the whole house according to the music, which kind of goes very well with Jake. I'm just calling him Jake, an imaginary name. So this was one. Then virtual pet therapy, coming back to what Keith Miller had talked about yesterday. But of course, his was robotic, but here was a virtual pet. So that was also there in the room. And AI-generated art therapy. So that was also part of the smart home. Can you imagine? I mean, the Jake seems to be gifted now. So he has everything. But again, this is just a case study, and not everybody can afford it. But you all know parents love their kids and they can do whatever for them. So this was one very unique one. And the next one was gamified mindfulness app. Okay. Sleep quality analysis. Third last, emotion recognition in video calls. So when they're talking, when their cousins are talking, or when their friends are talking, they would notice emotions through this body language. So that was, again, a wonderful thing. AI-enhanced therapy games. And finally, AI-driven mental health assessments. So this was how the smart home of this particular son looks like, Jake. And he's doing really well. And the parents are very happy for doing this particular. So this was a very outlier kind of a case study. And luckily, I got into them. I met them. And I requested them, can I sneak into your house and have a look? And that's where I made my notes asking them, okay, what's this? What's that? And this was something. So it actually looks like a sci-fi kind of a home, unbelievable. But it was important for you all to know that something like this is also happening, okay, around us. So this was one. And the next one, which I would be sharing with all of you, is these are those happy apps from AI, which you all can use. Okay. Yeah, please take the picture if you like, or if you can find it out, or go back to my references, which will really help you. Now it comes to my next lovely experiment. So as I told you, I have 88-year-old and an 82-year-old. One is very much my own mother and my mother-in-law. So what I did a coffee session with my daughter, who's a 16-year-old girl, and she doesn't believe in asking me anything. So even if she wants to go for a party or whatever, I'll say, sweetheart, you didn't consult me. I consulted my buddy. Now, who's the buddy? Is the AI friend of my daughter. And if the AI says, hey, you're looking good, you're looking fine, and go. So she doesn't bother to consult me. But that is not giving me any mental health issues, yeah, because I've adapted. There's a coping mechanism. Anyway, jokes apart. So I wanted the generations to meet together in the house and have some kind of a conversation, because my mother didn't have this kind of a system which my daughter is having right now. I always consulted her and she consulted whatsoever. So in the evening, I will make them all sit together, the two grandmothers and the granddaughter, and I will just tell them to roast each other and have fun with AI. So you will see what exactly do they have, what kind of conversation. I tried to script a bit, but this has gone so wonderful. I did this in December 2022, and I did another one in February 2023. And now it has become so popular that my mother-in-law invited two of her old elderly friends from the condo that come and have a good session. So what they do, they just sit in a room where some good warm snacks are available for them. My daughter is with them because she enjoys it too, and she's doing this as a school project for her school. And in Singapore, by the way, they really encourage students to do some innovative experiments, and it helps them as well. So she's preparing for a university, and she's doing this project also for that, objective in mind. So what happens in this room is the AI is on, one of these apps are also on, and they are just having the ball of the time. Okay, now see. So, okay, I'll come to this slide later. Have a look. Just imagine the room. Okay, right? I like the thingy. You see thingy? I'm telling you, it's super effective. And you can make out that it's super effective because I'm here smiling and doing things, because I told you, my mental health is also very important, right? So please, it's all connected. It's all part of an ecosystem, and we can use it so I literally put it on live, and the two people who are having fun and the speakers are going on, and just the computer just does it. And the screens, I have a screen and I connect with that. So it's very easy for the old ladies to read as well. Okay, look at this. Oh, this was like, she sparked up. Like, he knows it. He knows I do that, So again, these are those small micro expressions. And we have to collect those micro expressions. And after the session, I could see the vibe of my house was better. The generations were talking to each other. And now I'm super popular in my condo. And I get like, Bhanu, can you invite me for that? And now there have been 2 students, my own university. They are like, Bhanu, we want to study. And we want to take it to a different level altogether. So that's exactly where I wanted you all to know that this is something I didn't know it will work. I just wanted it to work it for me. But it can be expanded. And this is nothing but an AI and, of course, us helping and intervening in. And it's cost effective. Yeah. It's another thing which I wanted to share with all of you. Okay, continue, please. Right. Look at the last line. Yeah, that's exactly, that's the kick. And everybody, and you know what, the others who are from their own the group and they're watching, and it really sparks the whole thing up, and it really brings life, and it just makes us remember that yes, we are humans and we are doing well for ourselves. And what is the magic word? The coping mechanism. So don't worry, mental health is going to stay forever. Okay, we are not going to. But the one life which we have to take care. In that one life, what can we do better? So that is something which I wanted to share with all of you. Okay, I had one more. I didn't realize it. Look at this. This was like a mockery, sarcasm. So this was a sarcasm to my daughter. So they keep doing that. Because I've grown up being roasted by my cousins and friends. So now nothing matters, But again, things change. Society moved, and now we have social media. Now we have AI. We have to adapt. We have to cope. So again, these are few cluttered slides. I don't want you all to worry right now because I know you all have come from lunch. This is something which I would really request all of you to have a look. It's doable. It's really, really actionable. And it's a wonderful experiment and the study which we did. The themes which were converted, again, a cluttered slide for you all to do later, please. And this is the whole summary of the key factors driving the AI strategy. So I had even sometime the insurance people, all the mechanism which would come in between, the person who needs that help, and of course, very intense, where we need a hospital intervention is different. But AI can definitely help you at the early stages. So let's start there. And let's first of all admit that we all need to lighten up a bit and how to do that. And this is something which is really, really helpful. All right. So this was something I really want you all to pay attention. So just give me another 30 seconds and then I'll come to some friendly slides. The first category is AI-driven screening tools. From there, I moved to AI-driven powered analytics. From there, I moved to the third stage, AI-powered therapy sessions. And then the middle part, which is the blue and the yellow part, AI-powered adherence, AI-based reports, then AI-powered support system, and finally, AI-based engagement. So all the scholars in this room right now, you do have a lot of stuff where you can build. You can just do any one angle, one part of it, and you can further study on that as well. So that is another good way to do it. These are the outcomes, and the outcome was extremely positive. We had cost efficiency. We had, okay, so before I come to the conclusion, I would like all of you to focus on this slide. The sample size and representation was not so big. So you all can expand on it further. Number 2, I did not do any quantitative data analysis. So that is another thing I would leave all the lovely scholars to brainstorm further because that's how the journey goes. And the third one is concerns. I'm stammering right now. Dynamic technological landscape is also very important because we can cover many, many other countries as well. We couldn't cover many. We could cover a few in US, in Singapore. That was our limitation. And this is my 3 final conclusions, and I'll leave you with a wonderful journey of AI. It is extremely helpful, and I would really request all of you to use it to your benefit. Yeah? So did I bring value to your time?
Yes,
thank you.